We have very, very smart people on this desk, on this couch right now. How in the world are we going to save $300 billion over 10 years, get premiums down over the next 9 or 10 years, and still provide insurance for millions of Americans? The math is just not adding up. Somewhere,
let's get Leslie in on this,
missing.
though.
By the way, the way the premiums do go down is by putting a whole bunch of tax money at the premium.
But Leslie, you're obviously a liberal. Only 2 votes needed in order to sink this thing. What do you think the odds are it ends up passing?
I don't think it's going to pass, and one of the reasons is what I'm hearing from Republicans, and this is not, totally a partisan issue. This is, do we want to put profit over people? And a huge problem with Obamacare, and I will readily admit, as many Democrats will, are the rising premiums. This doesn't address the rising premiums for 1 and 2. Originally, when we needed health care reform, because people were going to the ER, they had no insurance, they had no preventative care. My husband's a physician, I own part of a medical center. This is a huge problem. This is going to be worse because you're going to have rural hospitals closing when you have Medicaid cut over time. And in addition to that, if you don't have a mandate and people don't have to buy insurance, what happens? There are less people on the insurance rolls, and what happens to the premiums? They go up higher.
I totally disagree with you guys, because it's going to happen in the risk pools. Eric, you know this well. If they do the reinsurance on the risk pools, that's the way to expand that money and help it cover more people. It's complicated, it's calculus, it's a lot of math. We won't know until it's there how well it's working, but that's the only way it works. Those risk pools can't be all taxpayer money. You put the taxpayer money in to start it, but private equity, Wall Street, everybody's chomping at the bit to get in on the reinsurance market on those risk pools. That's where it all lies.
I'm still trying to do the straight arithmetic on it, where we're going to get a tax cut. We're going to get a budget savings of $300 billion. Premiums are going to go down, and more people are going to get insured.
It doesn't work. Part of the risk pool. You know that math.
But part of the problem
I don't get the math. I honestly don't get that math.
But if you have people like Eric and I who ideologically don't find a lot of common ground, both of us dissatisfied with this bill, it's a huge loss.
Well, here's the alternative that Rand Paul, being the foolhardy senator that he is, doesn't realize. If he doesn't take the opportunity to use this reforms the individual insurance market. It reforms and budgets an open-ended entitlement and cuts taxes by $700 billion. You're getting in bed with Chuck Schumer. Chuck Schumer's road is single payer. Single payer as Medicare is going broke in 11 years. 87 cents on the dollar is what's going to be paid. We're going broke. Seniors insurance is going to get cut. They can't fix that, so that's the road to health insurance for the American people. That is ludicrous.
But there should be a third alternative. It can't be Obamacare anymore, and for my money, maybe not this one either.
Listen to Dagan, though. Broke in 11 years under single payer.
Broke in 11 years, 87 cents on the dollar, and they won't do a doggone thing about it.
Broke in 11 years.